Today I'm proud to carry House Bill 2673, a bill which seeks to create a safer, more efficient process for transgendered Oregonians to update their name and gender marker on their birth certificate so that they can more accurately and legally reflect who they are. Colleagues, I'm going to guess that most of you have never had an issue with trying to have identity documents that accurately reflect your gender. It's probably not something you've ever really thought a lot about. But if you are transgender, having accurate documents like a birth certificate or a driver's license can be the difference between getting a job, securing housing, and even accessing medical care. Having accurate documents can prevent or at least limit the discrimination you might face in these situations just for being yourself. Now, we know that due to a lack of understanding and societal acceptance, sometimes outright discrimination, that many transgender Oregonians experience economic hardship and instability. In the year 2015, the United States Trans Survey told us that more than 45% of transgendered people report verbal harassment. Nearly 10% were physically attacked, and 29%, nearly one-third of all transgendered respondents, were living in poverty. Furthermore, we know that about 1 in 10 transgendered individuals have accurate ID. Only 1 in 10 transgendered individuals have accurate IDs, and many transgender people avoid or delay updating their identification documents due to safety concerns, cost, and the burdensome nature of the change procedure. Again, this opens transgendered individuals to harassment and discrimination because when you give the bartender your identification card and it has a male-sounding name and you present as female, or when you provide a driver's license to a human resources professional, when you're trying to verify legal residency and you have an ID that has a female-sounding name but you present as male, you're outing yourself as transgender and exposing yourself to the potential for unwanted, maybe awkward, and invasive questions and possibly judgment and harassment. Colleagues, I want to share a story with you about a person named Gigi. She's a transgendered individual who grew up in LaGrande, Oregon. While she knew as a teenager that she was female, not male, she never felt safe to come out, let alone update her identity documents. She finally had the courage to start transitioning to male in the year 2012 at the age of 33 after her mother passed away. In her own words, Gigi says this: "It took 2 years to change my name and gender on my driver's license. As someone living on a very fixed income, I receive SSI and SSD. I could not afford this process without the help of Outside In, a Portland-based nonprofit. But cost was not the only barrier for Gigi. She had to share personal medical information with a judge in open court and post her private information on a bulletin board. Again, she says this: I had to provide my old name, my new name, and an explanation of why I want to change my name. I had to post a public notice with this information, as well as my home address and phone number on a public wall in the courthouse for a whole month. Having my personal contact information posted in the Multnomah County Courthouse was scary and anxiety-inducing for me. My stress levels were extremely high that entire month, and the day of the hearing was equally nerve-wracking and stressful, kind of like doing this. When it was my turn to see the judge, my old name was shouted out in a room full of strangers. Again, I only had just begun to feel comfortable living as my true self in public. To be reminded in a very public way of this name that does not reflect who I am, and to have no choice but to answer to that name was embarrassing and humiliating. Colleagues, House Bill 2673, with this bill, we can take a step to fix this issue for Gigi and other transgender Oregonians. House Bill 2673 will protect privacy and reduce costs for transgender Oregonians when they update their birth certificate by creating a centralized, administrative, one-time only option through the Oregon Health Authority and their Center for Health and Statistics, which manages these vital records. It will also remove an outdated public posting requirement for all those who seek a name or gender marker change through the court system, making that process safer for these Oregonians. Colleagues, before I complete my opening remarks on this bill, I want to thank my colleague, the good representative from Roseburg, House District 7, for his interest in expanding the scope of this administrative process to other Oregonians who also might benefit from the option to get out of a public posting process. The chair of the House Healthcare Committee has offered up one of his priority bills to look into this issue, and I look forward to working with the chair and the representative on a bill that brings all the stakeholders to the table to address the needs of these other individual populations, which include domestic violence victims, victims of sexual assault or stalking, and children who are adopted or in foster care who seek to change their names in order to help have a more workable policy and a process for the Center for Health Statistics to be able to do this. But for now, today, I hope you will all join me in taking the first step in supporting transgendered Oregonians like Gigi, and I urge your aye vote on House Bill 2673. Thank you, Madam Speaker. Colleagues, thank you for the discussion on the floor today, and for the testimony from the other sponsors, and for the statements that were made by my colleague from District 7. In closing, I just want to say that House Bill 2673 will protect privacy and reduce the costs for transgendered Oregonians when they update their birth certificate by creating a centralized, administrative, one-time only option through the Oregon Health Authority and its Center for Health Statistics, which manages vital records. It's going to remove an outdated posting requirement for all those who seek a name or gender marker change through our court system, making that process safer for these Oregonians. Myself and Representative Greenlick and a few others are committed to working with the representative from House District 7 on a bill that will hopefully make it possible to extend this approach to other folks in other situations in our state. And like I said in my opening remarks, I'm guessing that having personal identity documents that accurately reflect your name and your gender is not something that most of us have had to think about. But if you're transgender, having accurate documents like a birth certificate or a driver's license really can be the difference between getting a job, securing housing, and accessing medical care. We know that due to a lack of understanding and societal acceptance, and sometimes outright discrimination, many transgendered Oregonians experience economic hardship and instability in their lives. Please help us take a step today to minimize some of the stigma and discrimination that transgendered Oregonians face, and please vote yes on House Bill 2673. And I thank you, colleagues.